Well, as we continue our medical journey, I am actually going to be prepping for a colonoscopy. No, not really. I actually had my 50-year-old colonoscopy last year, but we're here at Augusta Health. We're talking with Carmen and Jennifer, and they are actually going to show us what you would do to prepare for that colonoscopy. First, Carmen, tell me, why is it important that every adult have a screening colonoscopy at the age of 50?
Okay, it's important to start at the age of 50 getting your colon cancer screening due to the fact of you could be diagnosed with colon cancer. 1 out of 20 Americans will be diagnosed with colon cancer, and 60% of those could have been prevented if you would have started at the age of 50.
Well, I mean, that ought to be an incentive enough for people to do it. And like I said, I did have mine last year, and it's not so bad. Jennifer, you're going to walk through, just like I really was a patient having my first screening, with some of the different preps. In fact, both of you can chime in and talk about preparing for that colonoscopy.
Okay. To prepare for a colonoscopy, it does take a couple of days. We'll give you a list of medications that you'll need to avoid 3 days before your exam. Usually 2 days before your exam, you're going to follow a diet called a low residue diet. And then the day before, we give you a diet called a clear liquid diet. And then we go into the preps for the exam, which you start the day before your exam, usually that evening. It can be anything from a Go Lightly prep, where you drink a whole gallon the night before your exam. Can be a mag citrate prep, which we give you 2 10-ounce bottles, which a lot of people like that because it's less volume. And then we do something called an osmo prep, which is usually 32 pills that you'll have to take for the exam. There's also something...
And when you're taking pills, are you taking high volumes of water with
You
those
are.
pills?
You have to usually take a bunch of water when you drink those pills with it. And then we do something called a movie prep, which...
And you don't have to drink as much with that. It's about half the size of the Go Lightly. You'll drink that instead, and it doesn't have any flavor.
And are you calling it a movie prep?
Movie.
Is there a reason that you call it a movie prep?
I'm not sure of the name. Why
Okay,
it's called that.
okay. So what do most patients pick? Or do the patients get to pick?
They do. The doctors will discuss which prep they want to go with, and a lot of our patients go with the Go Lightly. They'll drink that, but
then we have a few that like less volume, so they'll go with the mag citrate. We also have another prep called a half lightly, which is half of the gallon that they have to drink of the Go Lightly. So a lot of people.
So a lot of choices now for patients, even if maybe they have had a colonoscopy before and know what they did before, they could choose differently.
Yes.
So okay, then it's the day of the colonoscopy. Tell me what I would expect.
The day of the colonoscopy, you will be able to continue drinking clear liquids 3 hours before your exam. Then you'll come in, you'll go to our outpatient surgery department. They'll get you registered, then they'll bring you back, get your IV started. Then you'll have your exam. You'll be asleep, and you'll wake up, and it's going to be over.
And so if I don't have any polyps, how long can I wait till the next screening?
they recommend every 10 years having a colonoscopy done.
And if I do have polyps, those will be removed that day.
Yep.
And then does that change the frequency that I would have to come back?
Depending on the type of polyp. If it's something called a hyperplastic polyp, most likely you'll come back in 10 years, which means they are 100% benign. There could be some polyps called adenomas, which means they have the potential to turn cancerous if left in the colon. So depending how many of those are removed means if you have to come back in 3 years or 5 years.
So how long does the procedure last, and then after it's done, what then?
Usually the procedure will last about an hour, and then afterwards you'll go to recovery, and you're there for about an hour or so, maybe a little longer depending on how you handle the anesthesia that they give you or the sedation. And then you'll go home that day. You'll need a driver to take you home, and then you just won't be able to work or anything like that day of.
No food restrictions after you're done? Or?
Not usually.
Okay, well, great. Well, I can actually tell you I had my 50-year-old colonoscopy last year, and I can vouch for it really ain't so bad.
Your Health Matters, brought to you by Augusta Health.
1 in 20 Americans will be diagnosed with colon cancer in their lifetime. 60% of colon cancer deaths could be prevented if everyone 50 and older were screened regularly.
The state-of-the-art technology and certified staff at Augusta Health make the colonoscopy process more convenient and less stressful than ever before.
So, I think you should get your colonoscopy.
Augusta Health, nationally recognized quality, community-focused care.